Dr. James, tell me what's happening with the flu that's really going around. It's more severe in some parts of the country than others. I just finished a week of taking Tamiflu because I had been exposed to a few people with the flu over the holidays, and I called my doctor here and got Tamiflu as kind of a precaution because of the way that works. But we understand that the flu vaccine itself, the preventative shot, may not be too effective this year.
Yeah, that's exactly right. We're seeing a really severe flu season this year. I've seen a ton of cases in my office and in the ER, and unfortunately, less than half of the samples tested by the CDC this year have been a good match for the vaccine, and that's because of a mutation. So what we do annually is we try and figure out which strains are going to be the most prevalent out there for the next year. And usually it's H1N1 and H3H2, but unfortunately they've mutated this year. So we're seeing increased incidence in flu, and that Tamiflu is going to be our best combatant against the influenza virus.
Is Tamiflu actually effective in helping people who have contracted the flu recover quickly? I think it actually just prevents the virus from replicating. Is that right?
That's exactly right. It's a neuraminidase inhibitor and prevents that virus from replicating, and it has to be taken within 48 hours of symptoms. So if you can take it within 2 days of coming down with the flu, you will have a shorter duration and you will recover quicker.
What is the flu exactly? A lot of people think that they might have the flu, and really it's a cold, and there are a lot of symptoms that people associate with the flu that really aren't true.
Yeah, there's a lot of overlap with the common cold, which is most commonly caused by the adenovirus, and the influenza virus actually is a little bit more invasive. So it's actually going to cause a cytokine release. So you'll secrete tumor necrosis factor and all kinds of other medical mumbo-jumbo, but basically you're going to have inflammation throughout the body that actually causes tissue damage, and that's why the flu is so much more potent than the common cold. So you're going to have fever, cough, headache. You can have a sore throat and muscle pains. Specifically, the back and the legs are the most commonly affected by the flu. You can also have very severe fatigue that with sudden onset. So you're feeling bad, and all of a sudden, boom, you can't hardly even stand, and you have really bad back and leg pain.
I don't believe you mentioned like nausea or vomiting. A lot of people associate that with the flu.
No, that's pretty rare in adults, actually. Now, children, nausea and vomiting are much more common, but with adults, the nausea and vomiting is what we call the stomach flu, but it has nothing to do with influenza. So it's actually a gastroenteritis is what causes nausea and vomiting, but unfortunately, through mainstream jargon, we call that the stomach flu, but it's not the flu.
And this year's strain of the flu is shaping up to be worse than it has been in a few years. It's pretty rampant in 43 states that have seen an increase by at least 6% year over year. And so far in this season, I was about to say 2015, but in this flu season, 21 children have died from the current strain of influenza. Is that unusually high for the number of deaths that the flu can cause?
It's peaked a little early this year. I can't say it's a lot higher than previous years, but we have seen a small increase in the peak. Normally we peak around late January, early February, but we saw a ton of cases in mid-December, which is early. Now, the people that typically have major complications from the flu are going to be your children, your adults over the age of 65, and anybody with an underlying respiratory ailment like asthma or any type of emphysema or lung issues. But typically, healthy individuals are not hospitalized from the flu.
If you think you've got the flu, should you go to the hospital? Should you go to the ER?
Well, you should get yourself a concierge doctor like a Diamond Physicians and just give them a call and take care of it. But if you don't have access to a Diamond doctor, then it is a good idea to go ahead and go to the urgent care over the ER, because typically, like I said, the flu does not require hospitalization. So go to your local urgent care and take the flu test. And if it's positive, then Tamiflu will absolutely help if you can get that Tamiflu on board within 48 hours of symptoms showing.
And the flu test is just a simple swab of your nose.
That's right. It's a nasal swab. It's kind of uncomfortable, and it can make you cough a little bit, but it's a necessary evil so we can determine if you have the flu or not and make sure we're not treating an ailment that you don't have.
Is it a bad idea to skip the flu shot this year if you haven't gotten the shot yet, even though the strain that the flu vaccine this year is not exactly the one that's spreading? Is it a bad idea to skip it anyway?
Yes, it is a bad idea. We are still recommending the flu vaccine. If you are over 6 months of age, you should definitely get a flu vaccine. Although the match isn't perfect, you still will have some boosted immunity, and it takes about 2 weeks for the antibodies to form after the vaccination. Flu mist is appropriate for anyone from age 2 to 8, and then if you're over 65, they have a double-strength flu concoction now that helps with our geriatric population.
A concoction. That doesn't instill too much confidence in it. How does the flu vaccine work? How does the flu shot work? We hear people all the time talking about getting sick right after getting the flu shot. Is that kind of psychological, or is that actually happening in some people?
Well, the flu is an inactivated vaccine, so it doesn't actually cause the flu. But what it does cause is an immune response, and that's what you want. So you want your body to produce antibodies against the flu virus. And if that happens, then you might have a fever, some muscle aches, some soreness at the flu injection site, and that's normal. But you don't actually have the flu. So if you have a few of those symptoms, that's actually a good thing. It means that your body is having an appropriate response to the flu vaccine.
And if you're feeling sick, don't try to diagnose yourself on WebMD, or you'll wind up with cancer.
Yeah, do not do that. Don't Google your symptoms. Don't go on WebMD. That happens all the time with our clients here in Dallas, and I say, just give me a call and then we'll figure it out. But you will scare yourself half to death if you do that.
Bottom line is, get the flu shot if you haven't gotten it yet. It'll keep it from spreading to other people, and especially with kids. And if you think you might have the flu, you're showing any of the symptoms, go to an urgent care, call your doctor, see if you can get on a cycle of Tamiflu, and that will help. And just be smart when you're in social situations. Wash your hands, use hand sanitizer. If you've got a cough, cover your mouth, and don't spread it around and get the rest of us sick, which is why I've got producer Dan in his own room.
That's exactly right. Those are great tips. Hand hygiene is critical. Wash your hands as much as you can. Keep your hands out of your face. Don't touch your nose, your mouth, your eyes. That's a great place for the flu to get into the body. It loves mucous membranes. So keep your hands out of your face. When you sneeze, don't cover your mouth with your hand. Sneeze into your elbow. We call that the antecubital fossa, but kind of the part of your arm where your bicep meets your forearm.
Yeah, and Dr. James, maybe you could have told the Cowboys to keep their hands out of the Lions' faces.
Hey, that was not a pass interference call, and I'm sticking to it.
Dr. James, DiamondPhysicians.com. Great to talk to you again. We'll have you on soon.
All right. Thank you guys so much.